Have you ever stopped to think that some routine medical tests, the ones we take believing they are protecting our health, might actually increase the risk of a stroke overnight? It sounds hard to believe, right? After all, we trust our doctors, we follow recommendations, we do our checkups. But here's the truth. Some of these tests can carry hidden risks, especially after the age of 60. And as Dr. Vitallis always says, the right test at the wrong time can be just as dangerous as not testing at all. Now, imagine this. You walk out of your doctor's office feeling relieved, certain that everything is fine. But just a few days later, you start experiencing dizziness, blurred vision, or even more serious symptoms. What happened? The truth is, certain tests, especially when done too often or without real necessity, can quietly spike blood pressure, disrupt blood flow, and even open the door to a stroke. But don't worry, this video is not here to scare you. On the contrary, it's here to inform and protect you, helping you ask the right questions before agreeing to any test. Because after 60, it's not just about catching problems early. It's about avoiding unnecessary risks. In the next few minutes, I'll uncover the 5 most common medical tests with hidden stroke risks. And, more importantly, I'll show you exactly how to stay safe. If you're already over 60, type the number 1 in the comments. If not, type 0. And of course, make sure to subscribe here to Longevity, because we uncover the truths about health and aging that almost no one else will tell you. A contrast-enhanced CT scan is a very common test and often part of routine checkups. Chances are you've heard of it, or maybe even had one yourself. And if you have, you probably remember that sudden warm sensation spreading through your body right after the injection of the contrast dye. That liquid, known as contrast, is designed to make the images sharper, helping doctors see blood vessels, organs, and tissues much more clearly. So far, it all sounds beneficial. After all, modern imaging exams like this have saved countless lives by detecting tumors, aneurysms, and blood clots at an early stage. But here's the part that's rarely mentioned. That same contrast dye can pose silent risks, especially after the age of 60. Why does this happen? Because as we age, our bodies don't respond the same way to certain substances. Contrast dye can put stress on the cardiovascular system, and depending on someone's health condition, the effects can vary greatly. In some cases, it causes a sudden drop in blood pressure, leading to dizziness, nausea, or even fainting. In others, the opposite happens. Blood pressure spikes rapidly, blood vessels constrict abruptly, and the risk of a stroke increases. A study published in the Journal of Vascular and Interventional Radiology revealed a concerning finding. Older adults who underwent contrast-enhanced CT scans had higher rates of vascular complications within 72 hours of the exam. The most affected were those with a history of hypertension, heart disease, or kidney impairment. And to make this more concrete, let me share a real case. An 81-year-old man, seemingly healthy, went to the hospital for a routine abdominal CT scan. The test results came back normal, and he went home reassured. But just 2 days later, he suffered a mild stroke. Doctors concluded that the contrast injection likely caused a temporary spike in blood pressure, enough to trigger a clot that blocked blood flow to part of his brain. Now, this doesn't mean contrast-enhanced CT scans are bad. Far from it. When properly indicated, they can be life-saving. The point is, they should never be used automatically as just another item on a checklist. Each case must be evaluated carefully, weighing risks and benefits. And here's the most important part: how you can protect yourself. Before agreeing to this test, ask your doctor if it's truly essential in your situation, or if there's a safer alternative, like a non-contrast CT scan or even an ultrasound. In many cases, those options can provide enough information without the added risks. It's also critical to share your full health history. Let your doctor know if you have high blood pressure, heart or kidney problems, or if you've ever had a reaction to contrast dye or medications. The more details your doctor has, the more informed the decision will be.
Remember this, knowledge is one of the strongest forms of prevention. A test can absolutely save your life, but only if it's the right test at the right time for the right person. The so-called stress test or treadmill test is a well-known procedure. The idea seems simple and logical. The patient walks or jogs on a treadmill while electrodes monitor the heart's activity. The goal is to see how the cardiovascular system responds when put under physical stress. In theory, it sounds safe. For a young, healthy adult, it usually does provide valuable information. But after the age of 60, the story can be very different. That's because at this stage of life, the cardiovascular system is often more vulnerable, especially in people with a history of high blood pressure, arrhythmias, high cholesterol, or heart disease. During the test, both heart rate and blood pressure rise rapidly. The body is suddenly pushed into a state of exertion. For a younger adult, this may be just a temporary challenge. But for many seniors, that sudden strain can become a dangerous trigger. Among the possible risks are dangerous spikes in blood pressure, sudden arrhythmias, reduced oxygen supply to the heart muscle, and even small tears in fragile blood vessels, including those in the brain. A study published in the American Journal of Cardiology in 2020 analyzed more than 1,300 patients over the age of 65 who underwent treadmill stress testing. The results were striking. About 7% experienced adverse events during the test, including abnormal heart rhythms and hypertensive crises. The most vulnerable group? Those who already had existing vascular condition.
And this is not just numbers on paper, it's real life. Take the case of Margaret, a 74-year-old woman with long-standing high blood pressure. Her doctor recommended a stress test simply to check on her heart. Halfway through the exam, Margaret began to feel dizzy and developed chest tightness. The test was immediately stopped. The next day, she suffered a mild stroke. Doctors believe the sudden spike in her blood pressure during the test ruptured a small vessel in her brain. This shows us that the stress test, while useful in some situations, is not harmless. For certain seniors, it can indeed trigger complications. And here's the key takeaway. Talk to your doctor before agreeing to the test. Ask if it's really necessary at that moment. Ask if there are safer alternatives, such as a pharmacological stress test, which uses medication to simulate exercise, or even a resting echocardiogram. And remember, if you don't have symptoms like chest pain, shortness of breath, or extreme fatigue, there may not be any urgency to do this test. Sometimes waiting or choosing another method can be the wiser and safer option. At the end of the day, what matters most is that every exam you take is truly helping you, not adding unnecessary risks. Once again, knowledge is your best protection. Endoscopy has become an almost routine procedure, especially after the age of 60. It can be performed to examine the esophagus, the stomach, or, in the case of a colonoscopy, the large intestine. In many situations, this exam makes perfect sense, particularly when there are troubling symptoms that need urgent investigation. But here's what is rarely discussed. When endoscopy is done without a real need, and especially when it involves sedation, it may carry hidden risks that many people are never warned about. Why is that? First, because most people over 60 are already taking daily medications. Among them are anticoagulants and common blood thinners such as warfarin, aspirin, or clopidogrel. These drugs are essential for preventing blood clots, but they also increase the risk of bleeding. When an endoscopy is performed under sedation, natural changes occur in blood pressure and circulation. Now imagine that happening in a body already influenced by medications that affect clotting. The result can be an increased risk of internal bleeding, or even more concerning, disruptions in brain circulation that can trigger small strokes, also known as mini-strokes or TIAs. A large scientific review published in 2021 in the journal Gastrointestinal Endoscopy confirmed these concerns. The study showed that patients over the age of 65 who underwent sedated endoscopies experienced a significant increase in transient ischemic attacks, mini-strokes, within the 72 hours following the procedure. These weren't major strokes, but they were warning signs that something in the brain's blood flow had gone out of balance. For example, consider the case of a 76-year-old woman who went in for a routine colonoscopy with no major symptoms beforehand. 2 days later, she began slurring her speech and lost coordination. At the hospital, doctors confirmed she had suffered a mild stroke. They believed the drop in blood pressure during sedation, combined with her daily aspirin use, created the perfect conditions for a clot to reach her brain. Now, this doesn't mean endoscopy should be avoided. It can be critical and, in many cases, absolutely necessary. The problem is when it's performed without proper criteria. Before agreeing to the exam, especially if it's just for routine reasons, it's essential to talk with your doctor and ask, what is the real reason for doing this endoscopy now? What are the risks of sedation for someone with my health history? Is it possible to perform this procedure without sedation or with lighter alternatives? And never forget to inform your doctor about all the medications you take, especially blood thinners. That simple step can prevent serious complications. The key lesson here is that even procedures that seem safe and common, like endoscopy, can become risky if done without necessity or without proper preparation. And after 60, every health decision must be taken with extra care. Once again, knowledge is power. It's not about avoiding exams altogether. It's about making sure they are performed only when truly necessary and in the safest way possible. Magnetic resonance imaging, or MRI, is one of the most advanced and detailed exams in modern medicine. It allows doctors to see inside the body with incredible precision, detect tumors, identify brain abnormalities, investigate muscle injuries, and even spot early signs of conditions that might be missed by other exams. But there's one detail that deserves special attention. Very often, to make the images even clearer, doctors use a special contrast agent, usually based on a metal called gadolinium. This contrast highlights tissues and blood vessels, helping physicians spot things that might otherwise be missed. The issue is that after the age of 60, the body doesn't always eliminate this substance as efficiently as it once did. That's because kidney function naturally declines with age. And if someone already has some degree of kidney impairment, even if it hasn't been diagnosed yet, the risk becomes even higher. So, what's the danger? Part of the gadolinium may remain in the body longer than it should. This accumulation has been linked to a rare but serious condition called nephrogenic systemic fibrosis, which causes thickening and hardening of the skin and connective tissues. In the most severe cases, it can even impair movement, breathing, and organ function.
What's more, recent research has shown that gadolinium can also accumulate in the brain. While more studies are still needed, there's growing evidence that this may cause subtle neurological symptoms such as confusion, dizziness, and balance problems, particularly in people with pre-existing circulatory issues. A 2019 study published in Radiology followed more than 2,000 patients over the age of 65 who underwent contrast-enhanced MRIs. The findings were striking. About 5% of them reported stroke-like symptoms, including headaches, blurred vision, and balance problems within the week following the exam. To make this more tangible, consider the case of Harold, a 79-year-old veteran. He underwent a contrast-enhanced MRI to investigate persistent back pain. The results came back normal, but 2 days later he began experiencing weakness, dizziness, and mental fog. Only then did his doctors discover he had early-stage kidney disease, which had not been diagnosed before. Because of that, his body was unable to properly eliminate the gadolinium, and the substance lingered long enough to trigger those symptoms. Now, this doesn't mean MRIs with contrast are inherently dangerous. Far from it.
In many cases, they are essential and irreplaceable. The key point is that the decision to use contrast must be made carefully. So how can you protect yourself? Before undergoing the exam, ask your doctor, is contrast really necessary in my case? Can the MRI be done without contrast and still provide enough information? And if contrast is truly needed, ask for a simple kidney function test called a GFR test to ensure your kidneys can handle the substance safely. It's also important to let your doctor know if you've ever had unusual reactions to imaging exams in the past. Those details may be crucial in guiding the safest decision for you. Remember, the MRI itself is not the problem. The potential risk lies in the contrast dye and how your body processes it. With the right precautions, you can still benefit from the powerful insights of this exam without putting your health in jeopardy. Once again, knowledge and open dialogue with your doctor are the best forms of protection. The carotid ultrasound is a simple, painless, and non-invasive test. It uses sound waves to check for the buildup of fatty deposits or calcium in the carotid arteries, the major blood vessels that carry blood to the brain. At first glance, it seems like the perfect preventative exam: quick, safe, and risk-free. But here's the issue. When this test is done without symptoms or without a clear medical reason, it can sometimes cause more harm than good. That's because it's normal, as we age, for small plaques to form in the arteries. In many cases, these don't pose an immediate threat and can be managed with medications and lifestyle changes like diet and exercise. The problem is that when moderate narrowing is found, let's say 50% or 60%, many doctors refer patients to a vascular surgeon, and that's where things get complicated. At that point, seniors are often advised to undergo invasive procedures such as carotid endarterectomy or stent placement. While these surgeries can be life-saving in severe or symptomatic cases, for patients without symptoms, they often provide little additional benefit compared to managing blood pressure, cholesterol, and lifestyle through medical treatment. And here's the risk. These procedures can actually trigger the very thing they were meant to prevent: a stroke. A major study published in the New England Journal of Medicine followed more than 3,000 seniors with moderate carotid narrowing but no symptoms. The results were surprising. In many cases, surgery did not significantly reduce the risk of stroke compared to medical management. And for some patients, the procedure itself was the direct cause of a stroke, either during surgery or in recovery. Take, for example, the case of Helen, an 82-year-old woman. She felt perfectly fine, with no symptoms, but her doctor recommended a routine ultrasound. The test showed 65% narrowing in one of her carotids. Alarmed, she was sent for surgery. Sadly, during the procedure, she suffered a mild stroke and since has lived with partial weakness on her right side. Later, Helen admitted, "I wish I had known that doing nothing might have been safer." And that's the key message. If your doctor suggests a carotid ultrasound and you have no symptoms like dizziness, vision loss, or weakness, ask, what exactly are we looking for? If we find something, how will it change my treatment? If you're already taking medication for blood pressure and cholesterol and living a healthy lifestyle, clinical monitoring is often enough. Repeating the scan periodically may be safer than rushing into surgery. And don't forget, seeking a second medical opinion is always a wise step before agreeing to any vascular procedure. The big lesson here is simple. Not every preventative test is truly preventative. Sometimes it can lead to unnecessary and even risky interventions. After 60, every decision about health must take into account not just what might be discovered, but also what might follow that discovery. Once again, the key is to ask questions, seek information, and never hesitate to play an active role in the decisions about your own health. After everything we've discussed, one lesson becomes very clear. Not every test is truly necessary, and not every test is harmless. After the age of 60, our bodies react differently, and what seems like a routine exam can sometimes turn into a silent risk.
Tests like contrast-enhanced CT scans, treadmill stress tests, sedated endoscopies, MRIs with contrast, and even routine carotid ultrasounds can all carry hidden complications when they're done without clear medical reasoning. This doesn't mean you should avoid tests. Far from it. These exams can save lives when they're truly needed. What really matters is that every decision is made with awareness, with good information, and with the courage to ask questions. Ask if the test is essential, if there's a safer alternative, if it can wait, or if clinical monitoring might already be enough. As I always say, in health, the right decision is not the fastest or the easiest one, it's the most informed one. And now, I want to hear from you. Have you ever gone through a situation where a test brought more risks or doubts than real answers? Share your story in the comments. Let's learn together from these experiences. If this video helped you feel more informed and better prepared to care for your health, subscribe here to Longevity, share this content, and help others make safer, smarter decisions too. Your health is in your hands. Knowledge is power, and the power to make informed choices is the greatest gift you can give yourself and your loved ones.